Sorry, family, for the way I look, but it's more important that I get this message out there. Stay out of these hospitals. Keep your family, your loved ones out of these hospitals, especially in the metro Atlanta area. The well-starred hospitals, they ain't nothing but death centers. They use the night staff to kill people. I came in here because I had full body weakness. Because I'm a dialysis patient, my hemoglobin often drops too low. When that happens, I go weak. Because I'm in a wheelchair currently, I was unable to push myself around. Someone saw me yesterday and contacted the police and ambulance. They brought me to Wellstar Cobb. Now that I'm here at Wellstar Cobb, they didn't even address the issue with the low hemoglobin. All they did was address whatever it is that they could charge my insurance with very easily, which is dialysis, because I'm a dialysis patient. So the insurance is going to process it immediately. I didn't need dialysis. I had been on a regular schedule of dialysis for months. Even though yesterday was my regular scheduled day, Monday was my regular scheduled day for dialysis. So, they didn't have to give me dialysis on that day. I was feeling fine. I was not overloaded with fluid. I was breathing just fine. Had no temperature, no cough. I was just weak. I get here, and I'm wondering why is it that they're always adamant about putting an IV in my arm. And I think they are injecting people with the virus, claiming that they're flushing your IV with fluid. If I'm a dialysis patient and you're that worried about me having fluid on me, that you're rushing me down to dialysis, then why are you flushing my IV every chance you get? It makes no sense, unless there's something else you're trying to administer. Since I've been in the hospital, I've gone from no fever, no cough, no sore throat, no runny nose, to now all of a sudden, runny nose, puffy eyes, sore throat, cough, coughing up blood. For the past 14 hours, I've been asking for medication to make me more comfortable. Some kind of cough medication. And my blood pressure meds. I've been in this hospital now for over 24 hours. And since I've been here, I've only had a portion of a half a day's dose of blood pressure meds. I'm supposed to take 50 milligrams of hydralazine twice a day, every 12 hours. I'm supposed to take 12.5 milligrams of carvedilol every 12 hours. And I'm supposed to take 10 milligrams of amlodipine every 24 hours. And an 81 milligram aspirin every day. Since I've been here, I've only had 12.5 milligrams of carvedilol and 5 milligrams of amlodipine. And that's all I've had. I was admitted into room onto the fourth floor. Once I was admitted, they've done nothing. I've been up here now over 24 hours. They've done nothing until just now at 5:30 in the morning. They send in a young man talking about a blood draw for labs. Why didn't they do this much earlier? And the young man, to his credit, nice guy, but he was inexperienced. He poked me 3 different times, and neither time with a small butterfly type needle. Neither time was he able to get any blood. Now, one that says that either I'm just a hard stick, or B, I'm a hard stick because of a result of being somewhat dehydrated. So if that's the case, how can I be low on fluid but full of fluid in my chest and I have all the symptoms of pneumonia? Family, I ain't pulling this out of thin air. A while back, a similar situation, I just fell out of my wheelchair about a month ago. I wake up at Wellstar Kennestone, cramping from groins to feet on both sides, both legs. I was in severe pain, 10 out of 10. These people did not get any consent of anything and just put me on dialysis. I had no need for dialysis. I fell out of my wheelchair. But they stuck me on dialysis anyway. Then after I told them, when I woke up in pain, I told them to cut it off and disconnect me, return my blood. They admit me. They're insistent that I put on a BiPAP machine, claiming that my oxygen dropped too low. The numbers got to like 86, 89. They wanted it in the upper mid-90s. Now, I am a person that does use a BiPAP at home. So, I agreed to use a BiPAP, not knowing the cleaning procedures of the units. Long story short, I wake up 11 a.m. the next day, and I got more mucus, coughing, sore throat that felt like a strep throat. Then a little bit. That was the sickest I've felt in over 20 some years. I knew then it was not a coincidence. It was because of the unit. When I inquired from a respiratory therapist how they clean them, they claim that all they clean is the face mask, and they replace the tube in the face mask. They claim that by the time there's a filter that right there before it enters the unit, that filter does not catch everything, especially when you coughing. You got people breathing and coughing into the machine because they're having difficulty breathing. Not to mention, don't forget who was also using those machines. They were COVID patients. Do not trust these doctors or these nurses. The agenda is real. Where they're out here trying to do things to bill your insurance for whatever money they can, the easiest thing they can. They don't care to properly treat you. They just care about billing your insurance. They don't even give a damn if you die. If my blood pressure was important, why not maintain it? They've not, in 24 hours, they've done very little to maintain it. And I'm sick and tired of these fucking Jewish doctors that bring their ass up there, because it seems to be there's a lot of these damn Indian and these racist ass Indian and these racist ass Jewish doctors. Don't think for a fucking minute that just because a motherfucker's a Jew that he ain't a goddamn racist. Because a lot of them fuckers are Nazis. A lot of them are goddamn Nazis. Why you think that Nazi ass motherfucking Joe Biden is sending all that fucking money to Ukraine, but at the same time, Americans who built their home with their fucking hands right here on American soil can't get but $700 fucking dollars a month after having their homes burned down? Wake the fuck up. See that shit right there? See that Nazi ass motherfucker's name? I can't even pronounce that shit. Bakatari Tyree or some shit like that. This agenda to reduce the population is real. I have hundreds of videos